Welcome to another edition of Health Department Roundtable. I'm your host, Chris Schultz. With me today is our Health Director, Marty Golightly. How you doing, Marty?
I am well, sir. How are you?
Excellent. So the first thing, which is getting less and less exciting to talk about, but that's a good thing, is our numbers in Abington. So do you know where we are currently with COVID cases?
I do, and it is a very boring one case. One case with 2 people in quarantine, and that gives us a total of 2,010 cases.
Nice. And
So that's amazing. Awesome. We haven't had one case since April of 2020.
wow.
Yeah.
Good job, Abington, and good job, Health Department, keeping people safe.
Thank you, everybody, for all that you did.
So I presume some of the reduction in cases is due to the vaccination efforts statewide.
Has to be. Yep. Has to be. Thank you, everybody, for getting your vaccinations. Please continue to do so. If you have not, make sure you get your second shot, because you're not fully vaccinated until you get the second shot. If you still haven't got one and you're waiting for one to fall in your lap, we will happily make that happen. Just let us know. Give us a call. We can either schedule you an appointment at one of our local regional collaboratives, schedule you an appointment for one of our future events, or call you when we got a spare. Whatever the case may be, however it gets done the easiest, let us know. We'll try to make it as easy as possible.
And just a reminder for our watchers, if you're calling the health department, the phone number is 781-982-2119. So we've got, I guess, some exciting news coming this weekend. The state is going back to normal. With lifting all restrictions. Is that your understanding of what's happening?
All COVID-based restrictions, yes, essentially. There are still mask mandates in place in aggregate care homes, congregate care homes, medical facilities, and basically anywhere else that has a local or a business specific mask mandate. So please be respectful of any business that asks you to put a mask on. They're allowed to do that. That's not coming from us. It'll be coming from that business. The board voted on Monday to basically match the ending of the orders with the governor's orders, as I understand it. Is that right, Chris? Yeah. So we can go back to hanging out outside. You know, if you're around a lot of people indoors, I would strongly encourage everyone to wear a mask. I know if you don't want to, I completely understand, but we still encourage that kind of behavior.
So I think part of the confusion stores, and I remember talking about this early on, that this was going to be that confusing gray period coming out of the pandemic. So with the state lifting their restrictions, we're back to full occupancy in all businesses.
Yep.
And there is no mask mandate, although businesses may choose to require you to wear a mask at their discretion.
They may. And also, there are other communities who have chosen to keep their local mask mandates.
Okay. So, yeah, be respectful and don't give anybody a hard time. They're just doing what they need to do to feel safe.
Yep. And we still have to continue all of the COVID-based protocols that we have and contact trace any cases that come up. So we hope to be not having to do that as frequently as we've had to. But we'll see after that. So it doesn't really change much for us right now. But I've been saying it since, February, I think, cautiously optimistic.
Mm-hmm. And we'll see. I mean, the state and everybody else is still going to be keeping track of numbers. So if this starts pointing us in the wrong direction, we'll know pretty quick.
We'll have another lockdown. And please, one of the ways we can combat that is if you're sick, stay home. If you're sick, put a mask on to help protect other people. Us and your neighbors will greatly appreciate it.
Now, of course, the difficulty in coming out of this in the springtime is we're in full pollen season right now. So allergies are at their height.
Tell me about it.
Is just use common sense. You know what the symptoms for COVID are. If you're feeling feverish, I guess fever would be the key.
Yeah, the problem is everything we've been treating everything like COVID unless proven otherwise. So just do the best you can. This is not a zero-sum game. We understand that there are going to be. Well, I really thought it was allergies, Marty. Yeah, I can understand why you would think that. But do your best. Do the best you can.
Yeah, better be safe than sorry. So I know I was always looking for an excuse to stay sick from work. So there you go.
A lot of us are looking for excuse to say 6 feet away from each other still.
Yes. Yeah. There are certain things that that I won't miss, or that I will miss. Social distancing is one of them.
Yeah, but good news is, all of the events for Abington celebrates, all of the things that we would normally associate with summer can now happen. Memorial Day, there'll be an event. So we get to have a nice summer again, and hopefully we can put this in the rearview mirror.
Yeah, I will address that because somebody asked me today on the Life in Abington page. So the Legion is not doing their annual Memorial Day parade, but there will be a ceremony on Monday morning at the Veterans Plot at Mount Vernon. And the Scouts will be out reflagging the graves this weekend. So no parade, but everything else is back up. So all right, well, I think that's all we have COVID related, which is good news.
I'll take it. We do have some Red Cross learning events coming up. We're doing CPR, we're doing babysitters, and we're setting up CPR specifically for a couple of groups and for camp counselors. If you're interested in that, contact our office and we can help you out.
Awesome. All right. Well, I don't have anything else for you, Marty. It's Thursday. It's a nice day out. I know I have a lawn to mow, so I'm going to let you go and remind viewers, if you have any questions or anything specifically you'd like to see us address on these Health Department roundtables, please let us know. Now that COVID is not as much of a priority, we're hoping to branch out and talk about some other things going on in the health department. So let us know if there's something you want to hear about. And until then, stay healthy and be safe.